Okay, great. So welcome everyone to the third event of the Modal Learning Hub. And today I'm pleased to introduce Dr. Meytal Wilf, who's going to present the talk for us today. She did her undergraduate studies at the Hebrew University. This was followed by graduate studies at the Weizmann Institute. She did her PhD in the lab of Rafi Malach. She started a year after I left, so almost overlapping. Following this, she did a postdoc at the MySpace lab in Lausanne, Switzerland, with Professor Andrea Serino. And she's assured me that although it's called the MySpace lab, there's no relation to the old social networking platform. And she recently started as a senior researcher at the Center of Advanced Technology and Rehabilitation at the Sheba Hospital. Meytal, thanks.
Okay, so thank you, Jason, for inviting me. As I said, I really appreciate this initiative of Motor Learning Hub. So I'm actually part of the CATER, the Center of Advanced Technologies in Rehabilitation in Sheba. But today I will share with you what I did during my postdoc in Switzerland in the lab of Andrea Serino. And the title is The Neural After Effects of Sensory Motor Adaptation in Virtual Reality. And I have to warn in advance, I'm not going to talk about motor learning per se. I'm going to talk about what happens after we have motor learning. Okay. So just to give you a brief introduction, when we are experiencing the world, we need to interact with it. Our brain needs to integrate the inputs on the environment and along with the internal inputs of where our body is, what is our body position, the body size. But what happens if something suddenly violates this harmony? And there is no balance anymore between our predictions of the environment and what we actually receive as feedback from it. Then we need to update our actions and perhaps even update our perception in order to accommodate these new environmental conditions and regain balance. So when we interact with the world, our brain needs to, like I said before, so we learn during development to bring these three entities of our brain, our action, and our perception to work together in harmony. But if there is a violation in one of these nodes, it affects the other two. For example, this is harmony. After a damage in the brain, usually in parietal or frontal regions, there is some plasticity in the way we interact with the environment, and it affects our experience, our action, and our perception. And an extreme case of such damaged spatial representation is called hemispatial neglect syndrome. In this syndrome, usually after right brain damage, the patients are unable to attend to and interact with the left side of space. So they would eat only from the right side of the plate, shave the right side of their face. And if they are asked to copy a drawing, they would copy only the right side of the drawing. So there is a bias in attending to and acting on objects in the left side of space. And this syndrome, that in many cases results from a very focal brain lesion, actually has implications on all the brain connectivity and brain activity, even in the non-damaged regions. For example, this paper by Visuomotor showed that in hemispatial neglect patients, when they are asked to attend to retinotopic stimulus, the right hemisphere, if there is a high attentional load, the right hemisphere visual cortex has decreased activation with respect to the left hemisphere activation. So even though the visual cortex is sometimes not damaged, there is a problem or decrease in the brain activity in sensory areas in neglect patients when they need to attend the visual stimulus. And this unbiased representation in the brain is not confined to tasks. Also in resting state functional connectivity, there was a large body of work in recent years by the group of Corbetta in Washington State University that found that in neglect patients, there is a deficit in connectivity between large-scale brain networks, namely the attentional networks and the default mode network. And it manifests in less anti-correlation between these heteromodal networks. And most interestingly, this deficit goes hand in hand with the behavioral deficit, meaning the size of spatial bias will manifest in more disrupted resting state connectivity. And in a recent publication, they even showed that in spontaneous recovery from this neglect syndrome, these connectivity patterns again become more modulated as in healthy participants and in proportion to the size of the behavioral rehabilitation. So what we did in our work is go actually from the opposite direction. And we wanted to see what happens if we violate the harmony between the action and perception. We actually damage the experience of healthy participants. And will this show any effect on their brains? And the way that we did this violation of experience was using something equivalent to prismatic adaptation. And this is something that in a very short time can modulate behavioral and perceptual allocation of attention. Okay, so I will explain. So prism adaptation is used to recalibrate space. This is a very big word for what it does. What patients or healthy participants are actually doing is making repetitive goal-directed action towards a visual target while wearing prismatic glasses that shift all the visual inputs from their hand and their target to the right side of space. And then in order to compensate for this shift, they need to recalibrate their movement and their spatial attention more to the left side of space. I will show it more visually. So for example, if you ask a neglect patient to point to the middle of the space in front of their bodies, they will probably point to the middle of the right space because they cannot perceive the left side of space. But following this prismatic adaptation, when they are asked again to point to the middle, now they recalibrate their pointing movements more towards the middle, to the left side. If you do the same paradigm on a healthy individual, something different will happen. So if you ask a healthy subject to point straight ahead, they would have no problem doing so. But following adaptation, suddenly pointing straight ahead is biased to the left of the veridical midline. So there are many behavioral after effects following this prism adaptation. And these pointing after effects were found to last even 40 minutes after adaptation. So 3 minutes of training with prismatic glasses can last for 40 minutes of pointing biases. But especially for neglect patients, the biases of prism adaptations are not confined to the motor domain, but can also have effects on cognitive and even sometimes linguistic tests. And essentially every test that has a spatial component could be affected by these prismatic lenses, even auditory tasks. So in a healthy participant, this is less pronounced, but in neglect patients for sure. Okay, so the goals of the current study is to change the interaction with the world using adaptation. And by this to change the sensory motor coupling, and this has been shown before. We're just gonna verify it happens. And then we ask, is by changing the interaction with the world, we actually change how the world is represented in the brain. So can sensory motor adaptation affect brain activity during naturalistic perception? And even more, can this sensory motor adaptation affect spontaneous connectivity in the absence of task? And finally, is there some link between the modulation of brain activity and the modulation of behavior in healthy participants? So some very few works have been done before on these neural after effects. And one of them tried to see what happens to during a visual attention task before and after leftward or rightward prismatic adaptation. And they found that there was a modulation in an area in the inferior parietal lobule, the IPL, that was more activated following adaptation, and the increase of activation was dependent on the size of where the shift was, meaning it increased activation in a specific hemisphere, in the hemisphere opposite the shift. And we recently found that there is a modulation on resting state connectivity following prism adaptation. And if we take the same area in the IPL, which is part of the default mode network, we found that it became more decoupled. It decreased its connectivity with areas in the temporal and frontal attentional networks. So we found decoupling between the attention and the default mode network. And in all of the works, we found that many of the modulations was concentrated in this IPL region. So prism adaptation enhanced decoupling between default mode and attention networks during resting state and modulates activity in IPL during attentional tasks. So this is all nice, but the problem is that it's not very ecological to give this very repetitive prism adaptation training and this very lab artificial visual attention tasks. So for this, we wanted to move forward and use virtual reality to create this adaptation. The paradigm that we used was sort of a tennis game with dynamic targets that were thrown towards the participant, and they had to catch it. When the participant caught the target, they received a visual and haptic and auditory feedback. Okay. So the participant had to catch these tennis balls, but crucially, at one point, after several trials, the virtual hand was shifted 20 degrees with respect to where the actual hand of the participant was. So after perceiving this initial error in the reaching movement, the participants had to recalibrate their movements, in this case, more to the left side, in order to hit the targets again. So if we want to see what happens to the spatial motor biases, we can ask the participant to point straight ahead like they did with the neglect paper. And before the adaptation, they would do so quite accurately to point straight ahead. And following the adaptation, let's say if the shift was to the right, participants would bias their pointing movements to the left. And from this, we infer that they recalibrate their spatial representations. Okay, and this again is similar to what they did with actual prisms outside VR in the previous paper. Okay, so we had a pre-post design in which we wanted to see what would happen to resting state and naturalistic viewing before and after this virtual reality adaptation. So the participants arrived to the session and performed baseline training without any shift. Then we measured baseline behavioral measures that I will tell you only about the pointing straight ahead, but we took several other ones. And then they went immediately inside the MRI and did resting state and watched a series of short video clips. I will show you in a moment which movies exactly. Then participants went out of the MRI to perform another longer training session. This time there was a shift, and we had 3 groups of participants that did the training with a shift either to the right, to the left, or without any shift. Then we took behavioral measures again, and they went back inside the MRI immediately to do an identical fMRI session. And between the adaptation and the fMRI, they didn't perform any visual manual task. They just went immediately back in. And at the end of the experiment, we wanted to assess again the behavioral biases. So we measured them again after around 40 minutes from the adaptation. Okay, so I'm going to start by telling you about the movie experiment, the naturalistic free viewing experiment. For this, we used a well-validated set of short video clips that were created by David Nardo et al. And these short video clips are special because they have several spatial layouts. They were either right lateralized, meaning an interesting object appeared on the right side, bilateral, or left lateralized. And in the left lateralized, the salience stimulus was either on the left or on the right side. And we wanted to see whether adaptation would affect any or all these stimulus types, these movie types. And the participants viewed these movies without any fixation. They just really viewed them. Each movie lasted for 1.5 seconds, so they were really, really short. And there were many of those. Okay, so now for some results. First, we wanted to have the sanity check on the behavioral. So we wanted to see that the participants actually adapted. I didn't tell you, but they performed 160 trials, out of which the first 10 trials were without any shift. So you can see here in green, the accuracy on hitting the target balls before the shift and immediately after the shift. This is an average across the group of participants. And immediately after, the shift was quite big, but after around 10, 11 trials, the participants on average went back to hitting the targets. And to prevent questions later on, I will say that we recorded the position of the hand and the target error before the participant actually saw their hand. So this reflects the realignment process of participants without the online correction that they do when they're close to the target. So we see that the participants aligned enough in order to hit again the targets. And we actually record the behavioral after effects here after they finished all these 160 trials. And these are the behavioral after effect of the group that did the adaptation towards the left side, the left VR prism adaptation group. And we see that this is the deviation from the veridical midline when they did point straight ahead with eyes closed. We see that before adaptation, they were really in the middle. They had no spatial biases. Immediately following the adaptation, they had almost 20 degrees of bias towards the right. They recalibrated their movements towards the right. And importantly, these biases did not disappear at the end of the session, 40 minutes after the adaptation actually happened, but there was still evident even when they went out of the magnet, the MRI the second time. So this suggests that during the fMRI session, they had some behavioral after effect, residual, even if it decayed a bit with time. And in consistence with this, we found for the right VRPA group, no biases before adaptation and big biases towards the left side immediately following adaptation that had remained until the end of the experiment. And as expected in the sham group, the trained with no shift, we found no spatial biases in either of these phases. So yeah, like I said, subjects exhibited pointing bias opposite the shift immediately after and 40 minutes after adaptation. Yeah, I didn't show you the real life settings, but we tested this outside VR as well, and we found the same biases that were caused by VR training. Okay.
Can I interrupt with a question?
Yes, please.
So if you go back 2 slides, it seems that they did not fully adapt, right? It doesn't go back to 0. However, the after effects do seem to cover the full range.
Okay. So again, I was anticipating this question. So this is the position of the hand when it was halfway through, meaning I didn't go into details, but they did not receive visual feedback of their hand position in the space that was close to the body. They received it only in the last third of the hand trajectory. So this was before they could online correct, which is really big shift. If I had looked at the final position of the hand, these shifts would have been much smaller. So this is one thing that this does not reflect the entire adaptation, only before they could online correct. And the second thing is that the target had some volume, so they didn't really need to go to 0 in order to hit it. I think what the participants do is just they correct until they hit, and they don't continue because they got the good feedback, and then they don't need to continue to correct further. So yeah, I don't think it reaches all the way to 0, but maybe close to that. And yes, in here it seems like it's almost 20 degrees. I think it was about 18 degrees of after effect. And if you see on the right VRPA group, it's a bit smaller. And this is actually also something that is reported in the literature, that for healthy participants, leftward adaptation is more effective than rightward adaptation. But yeah, we can go into this later. Did I answer your question?
Yes, thank you.
Okay. So now we continue to what happens. This is what happens to behavior. And now let's see what happens in the brain following adaptation. So I remind you that we assessed the activity in response to free viewing of these short video clips I've shown you before. So this is just a group map of how response to videos looked like before and after adaptation. And not surprisingly, it looked like response to any naturalistic video. Any of you that ever ran such a stimulus knows that this is what we have. And they look quite similar. But if you look more closely, you see that there is some enhancement here in the right hemisphere visual cortex that appears after adaptation and not before adaptation. And indeed, when we do a direct contrast between the pre and post sessions, we find that there is an area in the right hemisphere parieto-occipital sulcus that enhances its responses to the movies after adaptation. Okay. And I will just say that this is an area that is retinotopic. It usually relates to peripheral vision and sometimes even to reaching movements in peripersonal space, meaning interacting with objects actually in the peripheral visual space. And this area was also found to be connected with error correction during prism adaptation by another neuroimaging study. And we wanted to see whether this enhancement of parieto-occipital sulcus was driven by one of these movie conditions or by each of them. And what we found was a strikingly similar pattern across all movie conditions. So it didn't matter whether the stimulus appeared on the right, on the left, or bilaterally. This parieto-occipital sulcus area in the right hemisphere was always enhanced following this rightward adaptation. Sorry. And then finally, we took this region as a seed and saw whether it has some relation to what we found for the behavioral after effects. And what we saw is a striking correlation between the modulation in pointing behavior and the modulation of activation in this right visual area in the POS. So from this, we concluded that changes in POS activity were correlated with changes in pointing straight ahead. And this, we found some evidence of a link between the behavioral and the brain modulations following this rightward VR prism adaptation. So just to summarize this part about the movies, VR adaptation successfully induced long-lasting motor after effects in healthy participants. Enhanced responses in the right hemisphere possibly reflect enhanced visual representation of the left portion of space following right VR adaptation. Because I remind you that the right visual cortex actually represents the left space. And this is actually beneficial when we want to think about this adaptation as a tool for neglect rehabilitation. Because in neglect patients, we want to enhance representation of the left space. And we see that this is exactly what we do with this rightward VR adaptation. And we found that the link between neural and behavioral after effects and suggests a common bias in spatial representation following adaptation. So it's not something that is linked necessarily to visual or to motor, but it's something more higher up in the hierarchy that mediates both of these after effects, probably. So to conclude, VR adaptation induced hemispace-specific effects on visual representations that were linked to spatial biases in motor behavior. So now I hope that I've shown you that the adaptation is able to change representation of the world in the brain. Next, we wanted to see whether it can, and also that it can be linked to the change in sensory motor coupling behavior. And now we wanted to see whether it's specific to stimulus-driven activity, or we can change also spontaneous brain resting state connectivity. And for this, just to complete this puzzle, we wanted to see whether this POS region that we found works alone or it interacts with other areas during the movies. So we ran a psychophysical interaction analysis, PPI, to see what areas it interacts with during movie viewing. And we found that before adaptation, this area does not interact with any area significantly, but following adaptation, suddenly this area interacts with areas in the left IPL and bilateral SDS, superior temporal sulcus, that are part of the default mode network. So then we wanted to complete the picture by seeing what happens to spontaneous activity following this adaptation. So I remind you that we had at the beginning of each fMRI session, we had a resting state with eyes closed. And we wanted to find a way to contrast these resting state connectivity patterns before and after adaptation. So the analytic approach was to record the functional connectivity before adaptation, inside each hemisphere and between hemisphere, and the same after adaptation, and to see what each type of adaptation does to these connectivity patterns. So the first thing we had to do was to find a way to get a snapshot of what's going on in the connectivity pattern in the entire cortex. So we segmented the cortex into 48 regions that are symmetrical between the two hemispheres, according to an atlas, to the Harvard-Oxford Atlas. And then we sorted these 48 regions in each hemisphere according to seven primary functional networks: the visual, somatomotor network, dorsal attention network, ventral attention network, limbic frontal parietal network, and default mode network. And there we wanted to receive a glimpse of the connectivity pattern between these ROIs. So this is the correlation matrix, the correlation pattern of these two groups, the group of the left VRPA and the right VRPA before adaptation. It's quite a typical correlation pattern with the sensory and attentional areas highly correlated and default areas and limbic area a bit anti-correlated to those. And then we subtracted this connectivity pattern in the post-adaptation, after adaptation, and before adaptation to see what is the modulation pattern that was induced by our adaptation. So blue colors represent negative modulation, reduced correlations. And we indeed found that in both left and right VRPA, the main effect of adaptation was decreased correlation, decreased connectivity in the cortex. And I marked here in a square areas that had a cluster of decreased connectivity. And again, like in the background that I showed you, we found that the main differences in connectivity were in the default mode network, frontal parietal network, versus attentional networks. And if you look closely, you see that for rightward VRPA, the decrease in connectivity was found mainly within the left hemisphere, this is left-left connections, and between hemispheres, this is right-left connections. And this was not the case following leftward VRPA. In here, we found that the bigger modulation was reductions in connectivity within the right hemisphere, and again, between hemispheres. And to complete the picture, this is what happens following sham VRPA. And when I say sham VRPA, this is actually a visual motor training. It's not that they are doing nothing. They are doing a visual motor training in VR. So instead of seeing reductions in connectivity in the cortex, we see enhanced, not very significant, not very big, but we see a little bit of enhancement between sensory and motor connectivity. So to summarize this, the adaptation causes disconnection in the cortex, mainly in the DMN and the attentional networks, and sham does not. If anything, it causes a bit of increased connections. And then we wanted to quantify these modulations in connectivity somehow. So this is a plot of the distribution of correlation values for each of the groups. Yellow is left VRPA, and cyan is right VRPA, and gray is sham group. And this is only in the inside the right hemisphere, the right connections. And we wanted to check where does the mu, the average of this distribution in each of our groups, in each of the quadrants, in each of the types of connections, within left hemisphere, within right hemisphere, and between hemispheres. And what we found was that both for left, like we saw in the matrix, for left and right, following left and right VR adaptation, there was reductions in the connectivity between hemispheres and in the left, between hemispheres and within the left hemisphere. And there was no such modulation after sham adaptation. And then we went back to our previous data following actual prismatic glasses. We wanted to apply the same type of analysis following prismatic goggles adaptations. And we found striking resemblance between our VR adaptation and prismatic adaptation with classic prismatic goggles. So again, there was a decoupling between default and attention, which was a bit stronger within the left hemisphere and between the right and left hemispheres. And when we added the prism adaptation to this graph, we see that it behaves as the VR adaptation and not as the sham VRPA. Okay, so to summarize, the spontaneous activity shows reductions in connectivity following VR adaptation, similar to classic prism adaptation, but not following sham training. VR adaptation reduced the connectivity mainly in the hemisphere contralateral to that of the shift and between the hemispheres. And following rightward VR adaptation, we found upregulation in right visual cortex, this we found for the movies, and reduced connectivity in the left hemisphere. So again, we found that VR adaptation induced hemispace specific effects on visual representation and on spontaneous activity, which unbalanced the cortical activity and connectivity. And this is a situation that is similar to what happens in neglect syndrome, in which they find unbalanced activity and connectivity. Oops, sorry. So just to give an overview of this, following left adaptation, we found reduced connectivity between left attention and right default mode network, and attention and DMN, reduced attention and DMN connectivity within the right hemisphere. And following right adaptation, we found, again, reduced connectivity between attention and DMN in left and right hemisphere, but now reduced connectivity within the left hemisphere. And we think that this reduced modulations in connectivity underlie the modulation in stimulus-driven responses. As we saw, the visual area is communicating with the default mode network, and probably this modulation, this VRPA-induced modulation in default, will cause unbalancing or biasing of how visual inputs or any other inputs would be perceived following adaptation. And this is actually a good thing for neglect rehabilitation, because these movies were actually shown to be processed differently in neglect patients than in healthy participants. In a recent paper, Nardo found that when neglect patients see the bilateral videos, they would look only at the right side of the video. And now we hope that this virtual reality adaptation can maybe rebalance the representation and the perception of naturalistic stimuli in neglect patients. And this will be the next step of this project. And I think we will skip the bonus part because, yeah, so. So I will end with a Greek phrase by Heraclitus: "No man ever steps in the same river twice, for it is not the same river and he is not the same man." So we saw that a very brief experience in VR that required our adaptation actually changed the way the brain is wired and the way it is responding to novel stimuli. And this was in healthy participants. In neglect patients, it might be even stronger. So I would like to say thank you to my lab in Switzerland, the wonderful MySpace lab, and my collaborators, Dr. Sonia Kota-Zerbet, and thank you to my new lab in Qatar and its head of the unit, Dr. Meir Plotnik. And if any of you is looking for a postdoc or a PhD and interested in VR and technologies for rehabilitation, we are hiring at the Center of Advanced Technologies. So you are welcome to send us an email. And thank you for your attention.
Thanks, Meytal. I want to ask you, what do you think there's any the effect of proprioception when they're doing these learning tasks? If even though the visual feedback is now shifted, assume they still have some proprioception, they realize they're moving straight ahead. Do you think there's conflict maybe between the proprioceptive feedback and the visual feedback might be driving some of the changes?
Mm-hmm. Yeah, I really do. I think it's a visual proprioceptive discrepancy. And I think that they have a bias also in their proprioception. And actually the work the study that I didn't show you was when we did the adaptation when a robot guided their hand. So they didn't do any volitional motor action, but they still do the adaptation passively with the robot. And after this passive adaptation, we found also that there were after effects in pointing straight ahead, meaning that proprioception and visual discrepancy is enough to drive these after effects. So it's not necessarily the motor that causes it, it's the inputs that don't match that cause the after effects. So this is in response to your question. And this was actually done even in the lack of awareness, because they were not aware that there was any shift. So something was happening subconsciously to their visual proprioceptive coupling. Okay, any other questions?
I have maybe a technical question. The movies were presented in some kind of block, or was it a continuous? So when you compare the pre-post and you get the parameter.
No, it's not a continuous movie. We wanted something that we can also do a GLM on. So it was actually some sort of event-related design.
Okay.
Let me show you. Yeah, so there was a resting state period. There was 1.5 second video, and then resting state that jittered between 4.5 and 8.5 seconds. So it was definitely not a continuous. It was very short. I think that the length of these videos were made especially to record eye movements. And this is also something that we'll do next. What Nardo did in his 2019 work, they recorded the patients were able to make only one saccade when they saw the video and not start scanning the entire scene. So this represents the biases in natural view and in exploration in a very clean way, I think.
So how do you rule out order effects? So in the second time, they see the same movies again, right?
Exactly in the same order. And also some trick that we employ is that the content of the movies is not the same, of course, between the conditions. In order to control for the content, we do for half of the subjects a flipped version of all the movies. Yeah, this was what you're looking for. So yeah.
I think so. Yeah.
Yeah, so it's either this or the other. And we just started running neglect patients actually with this paradigm. They do short-term and long-term rehabilitation training in VR, and we want to see how it affects their free viewing, natural viewing of videos. And when I say we, I mean they in Switzerland. Okay, any more questions?
Okay, great. Thanks a lot, Meytal. It's an interesting talk, and yeah, appreciate the presenting the results. And I'll be in touch. The next event will be in a couple of weeks. I'm going to present a workshop on sub-movements. I'll try and convince you that sub-movements are real, and then whether or not you believe they're real or not, we're gonna have a hands-on session using MATLAB or Python at trying to extract sub-movements. So details will be sent out in the next couple of weeks about that. And thanks again, Meytal.
Okay, thank you.
Thank you. Bye-bye.
Thank you.
All right, everyone. Bye.